Well, as Fabi said, my name is Dave, and I really appreciate you guys allowing me to just speak for a few minutes. I'm coming up on 10 years being cancer-free from leiomyosarcoma. So it was September of 2010, and I was working that day, and I'd recently had a CT scan. It was just somewhat of a routine doctor's visit, and it was, I teach high school band, and the doctor that day was one of my band parents, and I was just explaining some pain that I was having, and so for whatever reason, Dr. Cater said, well, maybe we should do a CT scan. And so we did the CT scan, and I really forgot about it. I didn't think much about it. And about a week later, the doctor called me and said, Dave, we need you to come down. We found an abnormality on your CT scan. So I go down, and he shows me the pictures and shows me the mass in my abdomen. And he says, we don't really know what this is. We don't know if it's benign or cancerous. We don't know if it's a hardened mass or fluid filled. All we know is we need to investigate that further. So they sent me to Birmingham to a urologist who said, well, I'm sure from looking at it that it's a hardened mass, so we need to biopsy it. So we did the biopsy, and best I can remember, it was like a month that I had to wait for that biopsy to return, results to return. And that was pretty nerve-wracking, because at this point, after a month's time, I started thinking, this is probably not good. So at that time, the Birmingham office had sent the biopsy to Johns Hopkins, and it just made its way around the doctors at Johns Hopkins, and it came back, leiomyosarcoma. So he calls and he tells me, well, it is cancerous. You have leiomyosarcoma. After he said that, you can imagine, I didn't really hear much after that. I didn't hear much of what he said. In fact, I'm really surprised that I was able to remember the words leiomyosarcoma, to go home and tell my wife. I'd never heard it before. I didn't know anything about leiomyosarcoma. I didn't know anything about sarcoma. And so we did some research, and there wasn't a lot out there. There's not a lot online about leiomyosarcoma, but the one thread that we did see in reading the various sites was, it's really best if you get yourself to a sarcoma center. So that's what we did. We went to Houston, and we met with Dr. Ravi at MD Anderson. And Dr. Ravi, after looking at the previous test results, said, well, we really think it's best if you stay here for the duration of your treatment, which was really good because we were like a mile away from the emergency room. And so we stayed there to do chemotherapy and radiation. They did all of that before surgery. They did it preoperative, and they had some really good reasons for doing that. And then about a year later, they did surgery out there at MD Anderson. And so I was diagnosed in September of 2010, and about a year later, the tumor was removed, and I've had no evidence of disease ever since then. So I'm thankful for that. I started reading the Josh Powell Foundation website this week, and there were two things that I thought were noteworthy. I was talking to Fabi out back, and the two things that really stood out to me on the website that resonated with me. The first was that they give the patients a care package on their first appointment, around the first appointment. And I just thought that was really interesting because as a sarcoma patient, the one date that you'll never forget is that first doctor's appointment. You'll never forget that day. It's probably the most challenging, the most weighty day of your entire experience because you don't know much about sarcoma. And so when you go in for that first appointment, you don't really know anything going in. And so for me personally, I mean, when he told me what it was, I passed out in the doctor's office. The look that I had going into the doctor's office that day and the look that I had coming out were two totally different things. And my wife was with me there that day at the doctor's appointment. She went in the appointment with me, and she remembers that day really well. In fact, let me have my family stand up and just so that you can meet them. Where are you guys? Stand up real quick. That's my kids, my wife. So that gift that you give the people in their first appointment is really a big thing because it lets you know someone's behind you and that they're with you on a very important day. The second thing that resonated with me was the mantra, keep going. Because for me, the most challenging part of cancer wasn't the actual cancer. It was the battle with the mind. It was the battle with the mental and the emotional strain, especially when you start going through chemotherapy. And so to get your mind under control, like Josh did, and keeping a positive attitude, and for me, I pretty much had the same mantra, except for me it was do the next thing. And what that meant for me is not thinking about the future, what's going to happen in the future, because you can't control any of that. What that meant for me is get up today, go to the doctor appointment today, go to the next family outing today, just do the next thing. So that's what that meant to me. And I would say, finally, if you know someone who's battling sarcoma, the most important thing they need, besides just you being there, is they need good counsel. And when it comes to sarcoma, there's just not a lot out there. And so I think all of the research and all the funding and all the attention that other cancers receive, I think that's really good. But with sarcoma, it's not well known, it's not well funded, and there's not a lot of research. So in addition to seeing that month of everyone wearing pink, I would like to see a month of people wearing yellow in the future to have more. This is an unknown, underfunded, and it lacks research. And so this foundation is bringing this cancer to light. And I just really appreciate Fabi and everyone who's banding together to cure sarcoma. Thank you, guys.